When do TB symptoms start after exposure? Have you ever wondered how long it takes for tuberculosis symptoms to show up after being exposed? Tuberculosis, or TB, is an infection caused by inhaling tiny droplets that contain Mycobacterium tuberculosis bacteria. After you are exposed, the timeline for symptoms can vary quite a bit. It depends on whether the infection stays dormant or progresses to active disease. Initially, after exposure, the bacteria can remain as inactive in your body. This is known as latent TB infection. Most people who get infected do not show symptoms right away and may never develop active TB unless their immune system weakens. This latent phase can last 4 months or even years without any signs. However, if the immune system can't keep the bacteria under control, the infection can turn into active TB disease. This stage is when symptoms start to appear. Typically, symptoms can show up anywhere from a few weeks to a few months after exposure. In many cases, people start to notice symptoms between 2 to 12 weeks after they have been infected. But keep in mind, this timing can vary based on individual health factors. So, what are the common symptoms of active pulmonary TB? They include a persistent cough that lasts more than 2 to 3 weeks, chest pain, and coughing up blood or sputum. You may also experience fever and chills, night sweats, fatigue, and weight loss. These symptoms usually develop gradually, so they might not be obvious right after exposure. Several factors can affect how quickly symptoms appear. For example, individuals with weakened immune systems, such as those living with HIV or those who are malnourished, may develop active TB sooner. Age also plays a role. Young children and older adults may show symptoms faster. In some cases, TB bacteria can reactivate years after the initial infection, causing symptoms to appear long after exposure. Because it can take weeks or even months for symptoms to develop, health guidelines recommend testing for TB infection after known exposure, even if you feel fine. This can be done through skin or blood tests. Early detection is crucial to prevent the disease from progressing and to stop it from spreading to others. In summary, TB symptoms usually show up several weeks to a few months after exposure. However, many people remain as asymptomatic for a long time due to latent infection. If you suspect you may have been exposed to TB, it is important to seek medical advice for testing and monitoring.